We're back with Mike and Athena live.
What's up, what's up? What's up, what's up, what's up?
The New York
Hey.
story was so long, we don't have time for any guests.
No,
so we'll see you guys
no,
next week.
I love Botox and filler. My friend Karen over here does it every other, was that your phone or my phone?
That's yours.
Every other 3 to 4 months. And it's interesting because I think some people, and
You
I'll
do
let
Botox
Karen.
every 3 to 4 months?
Yeah.
Wow. You
Yeah.
look great.
Thank you, but you know, I think it's because I'm so expressionable and I work out and all this stuff.
And expressive, too.
I don't think. Is expressionable a word? We have Karen Tessie here with us and Dr. Barry together. Kiss Me Injectables. It's so great to have you guys.
So Dr.
Karen,
Barry
Dr. Barry
and Karen Tessie.
So tell me, and either one of you can answer. So, you know, I was with all my RN friends from all over the place, diabetes educators, whatever, and they were telling me, you know, your Botox probably doesn't last long because you're so expressive and you work out a lot. Is that true? Can it not last as long, or should I laugh like this all the time? Maybe I shouldn't.
Definitely.
To make it last longer.
If you are a heavy exerciser, you
Yes.
will metabolize it faster. That's just
See?
the way it is.
We'll stop exercising.
No. Well, then the wrinkles will go away because then my face will.
Tell us the name of the company.
Kiss Me Cosmetic Injectables.
And it's awesome. Botox, fillers, you do. I don't name a bunch of stuff
Well,
that you do.
I'm also going to do dermatology consults of all kinds.
Okay.
All kinds of lesions, all kinds of conditions.
Is that going to be your specialty?
That is my specialty. That is what I'm
dermatology?
doing. And, of course, focusing mainly right now on all benign conditions. I was in a medical practice where I was working with skin cancer and conditions
Yes.
like that. But right now, I'm just working on the more cosmetic side of things.
Well, good. Off the air, I'll have to ask you about ringworm and all kinds of fun wrestling. My son's a wrestler, and someone said you need a good dermatologist because when they wrestle,
Yes.
dermatology is very, very important to athletes. But so now you're more on the cosmetic side now, strictly.
I'm strictly on the cosmetic side
Okay,
now, but I can't.
okay.
I will also do medical consults if people want them.
What about acne and stuff like that?
I will
Are you
do
going to
that as well.
concentrate on that?
Absolutely, I can do that as well.
What's it called when what Michael Jackson had when your skin,
Well, that's vitiligo.
stuff like that? Are you going to be doing that, or is it more beautifying?
Vitiligo is a very complicated condition. You need a light box and things like that. So that's really not something that I would be able to
Yes.
concentrate on.
Who
in
should
this
come see
cosmetic.
you at your
Your
business?
cosmetic.
Who's your average
Well,
patient? Who would-
anyone who wants Botox, who wants filler, who has benign growths like seborrheic keratosis, cherry hemangiomas,
Oh, I've never heard of
spider
that.
telangiectasia, all kinds of little benign
Well,
growths.
things don't kill
Yeah.
you, but it
Yes,
doesn't look too
benign
good, huh?
growths that you really dislike, that you would like to
Interesting.
have
Benign
removed.
growths. Okay.
I remove all of those kind of things.
I have
Very
skin
cool.
I have a skin tagger.
Yes, absolutely.
What do you call? What's the medical term for that? Something very serious.
Acrochordon.
Yeah.
See,
Yes.
that's why Dr. Barry is here. She's so smart.
Yes.
And Karen, so are you going to be concentrating, you know, more in the Botox, the fillers, and the, what's it called to remove this off
The
of Mike?
Kybella.
Kybella.
We do something called microneedling that we're very excited about. Dr. Barry's going to be talking about that
Really?
today.
Is that what you have right
That's
there?
what we brought.
And what is it? Needling?
This is called
Microneedling.
MicroNeedling. This is a microneedling pen, and this is one of the greatest inventions to come out in the last 10 years
I love it.
for skin rejuvenation.
To make you look younger.
Absolutely.
Like Botox. Okay.
So, the way this works is when you come in for a treatment, you get your face numbed up, and then we use this little needle. Turn it on like
Oh,
this.
God.
There's little fine needles in there, like about the size of a hair, and they hit the skin many times
I
a
see
second.
them. I see. Did you see?
So it's poking holes in your skin?
Yes, little micro openings, micro channels, and you run it over the whole face, and it causes little micro injury that then stimulates collagen and elastin. It gives a
Wow.
wonderful
So
result.
it will give you skin tightening then.
Absolutely.
Is
And
it
then-
the same kind of, I'm not going to say pain, Botox isn't very painful compared to the lip injections. But
No.
is it the same
It is
or
not.
is it less?
It is much less.
It's not
less-
introducing
it's
anything
less-
into your body,
less
like
than
chemicals like
Botox?
Botox, right?
No. So what you can do
Interesting.
is you can augment the treatment by using what's called the platelet-rich plasma treatment,
Okay.
which has been out there for a number of years, and a lot of the athletes have been doing that. So that's how everybody knows about that, where you draw the blood, you spin it down.
Yes, like the vampire facelift
Yes,
kind of thing.
exactly.
Okay.
So you spin it down and you get the platelet
Yeah.
buffy coat,
Yes.
and then you actually do the microneedling and you drip the PRP on at the same time, and it actually augments the growth factors, and it really augments the treatment. So
And we actually brought a video of that today.
Oh, do we have that, Michael?
Are we going to
and we
watch
do,
it? Let's watch it. And now, is this microblading right here?
This is microneedling.
Microneedling, excuse me. Microneedling.
With
Hit it.
PRP.
With PRP. Let's see it.
So what we're doing now is we're just using the leftover platelet-rich plasma, or the PRP, and massaging it into her skin that we've already microneedled. As you can see, it's not a red bloody mess. We call this liquid gold.
That's the way it works.
yeah.
Okay.
So you do the microneedling, and
Yeah.
then you put this PRP on. At
What's
the end.
PRP?
That's the plasma.
Platelet-rich plasma
Okay.
that you've spun down, because the platelets have all those growth factors that they then release when they're activated, and then it goes into those little microchannels, which stay open for a very brief period of time.
Wow, this
Because
is
they're
like
so small.
this
about
is
And
fancy.
It
It's
is.
I don't want to call it an
wonderful.
injury, but it's a very small thing that you
Very, it's
instantly
micro.
begin to heal.
Yes,
The
exactly.
skin seems to heal really well.
It heals very fast. Downtime is like that afternoon. You look a little red, like somebody sandpapered your face. Next day, you're perfectly fine.
That is
And-
so cool.
And the big issue of the day is I've developed this thing here under my chin. It's not uncommon, right, for men to get
not
that?
at all. Not only men, women too.
But you say maybe I'm a little too far gone for what's the thing you said?
Kybella.
Kybella. I'm too far
Kybella.
gone.
Oh,
for that.
he's too far gone
Yeah.
for Kybella?
Well, go ahead. Karen.
Well,
You see
Kybella
that?
wouldn't give you the result that you're looking for. What Kybella does is it melts the fat. But it's not going to take away the redundant skin
Oh,
that's
then I'm gonna have a
left
big old
over.
flap.
Exactly.
Yeah,
You'd have a little
exactly.
floppy thing. So
I want to
you're-
look the age that I say I am on Facebook.
then you're a
Yes.
surgical
How old do
candidate.
you say that you are?
I'm 48.
Oh,
There
yeah,
you go.
right.
You could pass for
And I'm
48.
6 feet
I do
tall.
every day.
Well, I will say you have beautiful skin. I'm
Thank
sitting
you.
here.
He does.
I'm
Doesn't he?
looking at his
I
skin, and it's
agree.
absolutely beautiful.
Yes.
He's
I
got beautiful
agree.
skin.
That's
You
why
want
I'm on
smooth
television.
skin.
They put me on
Yeah.
TV just for the skin.
Where's
so,
your wrinkles?
So you actually would do a surgical.
And it's so smooth.
So you would need to see a plastic surgeon and have a lower facelift.
Is that you?
No, that is not
Oh,
me.
but you would
that
refer
that is
me-
a plastic
but can
surgeon.
you recommend someone, or you?
There are
you guys
plastic
friends with
surgeons
quite
in
a few?
town who do this procedure. So plastic surgeons have a surgical residency, and then they do an additional fellowship for plastics.
This is very interesting. Every year they come out with new stuff, and I think cosmetic, everyone a few years ago was like, oh yeah, I get Botox. They were afraid to admit it. I'm like, come on. It's so common.
It's good,
And
like she
women
does
are
on the
looking
show.
younger
She
and
talks
younger.
about Botox,
Oh,
and she's
yeah.
telling women out there watching.
Yes.
We have viewers, people watching. It's okay, and look at the outcome, the result. Look how beautiful
I'll have to
it's
tell
in
everyone about you. And it's so funny because you have to be good at what you do. Because I call my friend Barbara, I said, I need, wasn't I going for a meeting? I was going for a meeting.
Yes.
And
Yeah.
something, I was going to someone else, but they were renovating the office and they closed down. I said, oh no, I need Botox to make myself look younger. And my friend Barbara, she's a nurse practitioner, she said, call Kiss Me Injectables. And that's how we met. So it's so good to meet you. And
We need to do a
all
couple
this new
things here
stuff.
because we're out of time. But
okay.
if somebody
And
just
Karen's
wants
got
a-
hair products over there. I
Yeah.
want to talk to her about
If
that.
somebody just wants a consultation, they should call you guys, make an
Yes.
appointment, just
Yes.
come in.
Make
For
an appointment to come in.
microneedling, skincare, Botox fillers, Kybella, all that fun stuff. And Karen,
One thing I did want to say, we're also using PRP, the platelet-rich plasma, in
Okay.
the scalp for hair rejuvenation.
what?
So
Yes.
if your hair is
This is
thinning, we have
crazy.
photos right there on the screen.
Oh my God, this
with,
is so
that's with
awesome.
one treatment
I need
of
that
PRP injected into the scalp. We're seeing great results. And we also brought with us, just so you could see, a little kit here of some of what you'll get when you come in to see us. So it would be great if you're struggling with aging or hair loss. We would love to see you.
And do you have a website that
We
people can
do.
go to?
It's www.kissmeci.com. The letter C, the letter I.
And is there a phone number they can
Yes,
call?
559-838-0500.
Anyway, it's my job to get us out there. Any last thing? You guys got about a few seconds.
Do
if you
we
wanna say
forget
anything.
anything, you guys? And they're right
We're gonna bring them
above,
back in a
above
few.
and below Bobby Salazar's, and it smells like so awesome. They're like
Which
in a
Bobby's?
really cool. The one at Alluvial, Fresno and Alluvial.
Okay.
So go.
Okay.
Oh, I have a question, real quick. We got the phone number and the website and all that there.
Yeah.
Is there a website?
Yes.
Okay. So are you open on the weekends or just Monday through Friday? Did you say that
We
already?
are open some Saturdays as well. So if
Okay.
you work during the week and you can't
Yes.
get there because of kids or work or whatever, you can come in
Yeah.
on Saturday.
Okay.
However, we do have 2 late nights where we're there as well. So we
What
are
nights are those?
Tuesdays and Thursdays.
Until 7 or something?
Yeah, until
Or-
we're done. Could be
Okay.
8 o'clock. Whenever
I'm
we're
coming
done,
at
we're done.
midnight. I'm going to go out to the bar. Shoot me out with
Don't
Botox.
go anywhere. Paul Bonander is coming up next. The great real estate broker
know.
from Kingsburg and Fresno. We'll be right
He'll
back.
sell you a house down by the river.
Yeah.